flexion. Okay? Yep, we'll put your head down here. So these are graded differently. You do not apply a break test for the abdominals. Okay? So you are going to be supine. Now the stabilization for any grades over 2 is making sure the cervical spine is in slight flexion and they can maintain a posterior tilt. Okay, so pillow spine, yeah, and you want to have their legs out long. All right, so for a grade 1, I'm going to just palpate your abdominal muscles here. So I'm going to have you try to tuck your hips under, yeah, like posterior tilt, so belt buckle to the ceiling. So that would be a flicker of motion would be a grade 1. Okay, if they can't even do a posterior pelvic tilt, that's a 0. All right, that's a posterior tilt. Yeah, posterior pelvic tilt is tucking your toe on that.
So what's the screen test?
There is no screen test. There is no break test. Yeah, the base for abdominal strength is can they even do a posterior pelvic tilt? Okay, if they can't even do a posterior pelvic tilt, they're 0.
And so that's why you don't want their knees up, because that would already be
Exactly. Yep. Okay, so one is a flicker of the muscle contraction, and then a 2, you're going to bring your arms straight out in front of you, okay, holding a posterior pelvic tilt, because that's our base for even getting any sort of grade on this. You're going to try to just lift your head and your neck up off the table. That's a grade 2, just the head and the neck, okay? Now a grade 3, keeping your arms outstretched in front of you, holding a posterior tilt, head and neck flexion off the table. A grade 3 is all of those requirements plus the inferior angle of the scapula lift off the plinth. So go ahead and try and do a sit, yeah. So that's a grade 3, inferior angle all the way off. Grade 4, all the requirements of a grade 3, but now you're going to cross your arms across your chest. Okay, so just to see what you can. Holding posterior pelvic tilt, okay, tucking the chin, lifting the head up off the table. Can her shoulder blades clear the table? Ooh, inferior angle. Oh, she's got a grade 4. Inferior angle's off. Okay, and a grade 5, all of those requirements, but now the arms are beside the ears. Okay, let's see if she get a grade 5. Ready, set, go. Can her inferior angle come on? Ooh. Oh. Yeah, she's up. Really? No. That's really good. It's hard.
I have a question.
So, yes.
Was it grade 2 where the arms were in front?
Yeah.
Is it supposed to be in front like this?
Nope,
Or
just
they're
straight. Yeah,
they're
just straight.
lying?
Yep, just outstretched in front of the trunk. So basically it's like right here.
Wait, because she had them at her side. Like
Yep,
that
so
the
it
whole
should
time.
be arms outstretched in front of the trunk, like right about like there.
Oh, okay,
Like
so we didn't do that.
Oh, let's redo that, okay? So I'm going to show you this method and another method that I use more often, okay? So grade 1 is a posterior pelvic tilt, okay? Posterior pelvic
So
tilt.
arms are down.
Arms are down, yeah. So posterior tilt, okay. Grade 2 is neck and head off the plinth. Grade 3, arms outstretched in front of you, and inferior angle comes off the plinth, right? Grade 4 is arms across your chest, inferior angle comes off the plinth. Grade 5 is arms behind your head, okay? Incidentally, this is a little tough on the lumbar spine sometimes, okay? So here's another method you can use too. This is the double leg lowering method, all right? Now, you're going to always have to maintain a posterior pelvic tilt. So maybe what I'm going to do is slide my hand right underneath your low back here, and I'm going to have you try to squish my hand, so flatten your low back out into the, yep. And your job is to hold that the whole time. Okay? And we're going to bring your legs up in the air. So we're going to bring them all the way up in the air. And so go ahead and give me a pelvic tilt. So squish my hand. Arms can be at your side, wherever you're comfortable. So you're going to do a really good pelvic tilt. There's some switch my hand. There you go. And you relax. Let me just bring it like that. Okay? So this is your start position. So you have to squish my hand the whole time. Okay? And you got to breathe. All right? So your job is to keep squishing my hand, holding that pelvic tilt for as long as you can. And as you lower your legs down, you're going to keep trying to squish my hand. Now, we grade it when you stop feeling that pelvic tilt. So when she starts going into an anterior tilt, we'll grade you. Okay? So We're gonna eyeball and see how far down her legs can get. So ready, set, go. So you're gonna lower your legs down, but keep squishing my hand the whole time. Keep squishing, keep going, keep squishing, keep going, keep going, keep going, keep squishing, keep squishing, keep squishing. Okay, and we're starting to lose it right about there. Okay. So what do you think? How far from the plinth was she?
45.
About 45 degrees. I agree. So I would say that was probably like 4 minus. So I actually tend to use that one a lot more than the other one because I feel like the other one is actually just kind of a hard position to be in for the lumbar spine, and this one you get more.
That one's harder.
It's harder.
I'd say the
It's a lot
second one's
harder.
harder.
So try both of them, okay? And actually, let me show you real briefly trunk extension since it's kind of graded the same way, okay? So go ahead and turn over onto your tummy. And so trunk extension, actually we're going to have your feet over the other end of the plank, sorry. Yeah, and a pillow underneath your tummy. And stabilization would be strap or my hand over their pelvis, okay? And arms are going to be at your side. And what I'm going to have you try and do is just try to lift your sternum up off the table, okay? So a 0 is no movement or maybe contraction, slight contraction, 0 or 1, okay, of the trunk extensors. Grade 2, arms by their side, patient lifts their head and the upper portion of their sternum off the plinth is a grade 2. Grade 3, hands held behind your low back, so yep, and then trunk extension through partial range, so the upper portion of the sternum off the plinth, that's a grade 3. And hands behind your low back here for a grade 4, you're going to lift and your head up off the plinth and your sternum all the way up to your xiphoid process off the plinth is a grade 4. Okay, so grade 4 xiphoid process clears the plinth, and a grade 5, same requirements as a 4 except for now the hands are behind the head.
Do you stabilize the lower legs for this?
You just want to be stabilizing the pelvis. Yeah. Okay. So this is kind of a tough one to do for a wide variety of patients, but you can use that with a young kind of active population. Okay.
Would you demonstrate all 5 grades before you have them lie down?
No, usually I just talk them through it and see what they can do. Yeah. Okay. So you're just observing and seeing what they can do. So why don't you guys run through those briefly? Go ahead and do trunk extension.